Bismillahirrahmanirrahim. Assalamu alaikum. Today inshallah we will discuss the internal surface of the anterolateral abdominal wall. This is the anterolateral abdominal wall. This is posterior abdominal wall. Today we will discuss this surface. This is the internal surface of the anterolateral abdominal wall. First of all, I will revise the layers of the anterior abdominal wall. We have skin, then we have superficial fascia. In the superficial fascia, we have two layers. First of all, we have superficial fatty layer, which is named as fascia of Kemper. Then we have the superficial fascia deep layer, which is Scarpa's fascia. This is deep membranous layer. Then we have muscles. First of all, we have external oblique muscle. Then deep to the external oblique, we have internal oblique muscle. And then we have transversus abdominis muscle. Deep to the transversus abdominis, we have fascia transversalis. And then we have the extraperitoneal fascia. This is the fat, which is extraperitoneal fat. It is also named as endoabdominal fascia. Deep to the endoabdominal fascia, we have the parietal peritoneum. This is parietal peritoneum. This is skin. This is superficial fatty layer or the Kemper's fascia. This is Scarpa's fascia or the deep membranous layer of the superficial fascia. This is umbilicus. This is external oblique muscle. This is internal oblique muscle. This is transversus abdominis muscle. This is fascia transversalis. This is extraperitoneal fascia. And this is parietal peritoneum. In this diagram, you can see this is skin. Then there is superficial fascia, which is the fascia of Kemper. First, fatty layer. Then there will be deep membranous layer. This is membranous layer, which is Scarpa's fascia. Then we have muscles. This is external oblique muscle and external oblique aponeurosis. This is internal oblique muscle with internal oblique aponeurosis. This is transversus abdominis muscle with transversus abdominis aponeurosis. This is rectus abdominis muscle, and this is the rectus sheath, which is the anterior and posterior coverings of the rectus abdominis muscle. This one is the fascia transversalis. This is fascia transversalis. Deep to the fascia transversalis, we have again a fat, which is extraperitoneal fat. And deep to the extraperitoneal fat, we have parietal peritoneum. This is parietal peritoneum. This whole is parietal peritoneum. And this one is the visceral peritoneum. Visceral peritoneum. Deep to the visceral peritoneum, we have all viscera which are included in the gut, and these viscera which are covered by the visceral peritoneum are named as intraperitoneal organs, and no structure or no organ is present in the peritoneal cavity. This is peritoneal cavity. The intraperitoneal structures, they are present inside the visceral peritoneum. This is posterior abdominal wall. The viscera which are present here will be retroperitoneal because they are behind the parietal peritoneum and they will not be covered by the visceral peritoneum. This is pre-peritoneal space. This one is pre-peritoneal space. What is fascia transversalis? The fascia transversalis, which is deep to the transversus abdominis muscle. It is a thin aponeurotic membrane. It is in between the transversus abdominis muscle and the extraperitoneal fat. What is extraperitoneal fat or extraperitoneal fascia? It is deep to the transversus abdominis muscle and the transversalis fascia. It is a layer of connective tissue which is separating the transversalis fascia to the parietal peritoneum or from the parietal peritoneum. It is containing varying amount of fat. This layer not only lines the abdominal cavity, but it is also continuous with the similar layers lining the pelvic cavity. It is abundant on the posterior abdominal wall. See here, this is posterior abdominal wall. Here this fascia, which is the extraperitoneal fascia, is abundant, especially around the kidneys it will be abundant. It continues over the organs which are covered by the peritoneal reflections. As the vasculature is located in this layer, it extends into the mesenteries with the blood vessels. Viscera in the extraperitoneal fascia, they are named as retroperitoneal. That is, the organs which will be present here, or the structures or viscera which are present here, they will be retroperitoneal organs. So this is preperitoneal fascia and this is retroperitoneal fascia. This fascia, which is extraperitoneal fascia or endoabdominal fascia, it provides a plane that can be opened, enabling the surgeons to approach the structures on or in the anterior aspect of the posterior abdominal wall. See here in the diagram, this is posterior abdominal wall and this is the anterior aspect of the posterior abdominal wall. So there are kidneys which are present, there is aorta and there is the lumbar vertebra. See here, this is lumbar vertebra. So they are without the visceral peritoneum. They are not covered by the peritoneal sac which is covering the abdominal viscera. Thus the risk of contamination will be minimized because the surgeons can open this fascia and they can reach these viscera directly without opening the peritoneal cavity. An anterolateral part of this potential space between the fascia transversalis and the parietal peritoneum. This is named as space of Bogros and it is used for placing the prosthesis when repairing the inguinal hernia. So there will be space of Bogros where the mesh can be inserted. Now in Viva, the question is asked that what are intraperitoneal organs and what are retroperitoneal organs. The intraperitoneal organs are stomach, appendix, liver, transverse colon, duodenum, only the first part, small intestine, pancreas, only the tail, and the rectum, only upper 1/3 of the rectum, and spleen. And the retroperitoneal organs are the adrenal glands, aorta, inferior vena cava, the second, third, and the fourth parts of the duodenum, the pancreas except the tail, the ureters and the urinary bladder, ascending colon and the descending colon, kidneys, esophagus, and the lower 2/3 part of the rectum. Now what is parietal peritoneum? See here in this diagram, this red colored line, this is parietal peritoneum. The deep sides of the wall of the abdomen, they are lined by the parietal peritoneum. This is a thin serous membrane and it is continuous below with the parietal peritoneum lining the pelvis. The peritoneum lining the walls is the parietal peritoneum. It is and the covering which is covering the viscera. It will be named as visceral peritoneum. In this diagram you can see the blue layer. This is visceral peritoneum because it is covering the viscera. So this is visceral peritoneum. The parietal peritoneum is continuous lining of the abdominal wall forming a sac. This is a sac. This sac is closed in men, but it has two openings in women where the uterine tubes provide a passage to the outside. The closed sac in men and the semi-closed sac in women is called as peritoneal cavity. So this is the peritoneal cavity or peritoneal sac. There is no viscera present inside the peritoneal cavity. The viscera, it is enclosed by the visceral peritoneum, or the visceral peritoneum is attached to its outer surface, and these are intraperitoneal organs. No structure or organ is present in the peritoneal cavity or the peritoneal sac. Now, the main point of this lecture which we have to discuss is the internal surface of the anterolateral abdominal wall. See here in this diagram, this is umbilicus. This is the supraumbilical part of the anterior lateral abdominal wall, and this is the infraumbilical part of the internal surface of the anterior lateral abdominal wall. Again, I will explain. This is the internal surface of anterior lateral abdominal wall. We have reached up till the parietal peritoneum. This is parietal peritoneum. Now there are some folds which are attached or present on the internal surface of the parietal peritoneum. So this is umbilicus, this is supraumbilical part, and this is infraumbilical part. First of all, I will discuss the infraumbilical part of the anterior lateral abdominal wall. See here in this diagram, this fold is named as median umbilical fold. Median because it is in the center, umbilical fold because it is attached to the umbilicus. It is extending from the apex of the urinary bladder to the umbilicus. See here in this diagram, this is urinary bladder and this is the apex of the urinary bladder, and this is median umbilical fold which is extending up till the umbilicus. It is covering the median umbilical ligament, which is a remnant of the urachus. The urachus was joining the apex of the fetal urinary bladder to the umbilicus. So now in adults, the urachus has been replaced by the median umbilical ligament, and the presence of the median umbilical ligament is shown in the form of median umbilical fold. Then there are two medial umbilical folds. See here in this diagram, these are two medial umbilical folds. They are lateral to the median umbilical fold. These medial umbilical ligaments which are present underneath the medial umbilical folds, they are formed by the occluded parts of the umbilical arteries. So this is the remnant of the umbilical artery. Then there are two lateral umbilical folds. See here in this diagram, lateral to the medial umbilical folds, there are two lateral umbilical folds, one on each side. They are covering the inferior epigastric vessels and therefore they will bleed if they cut. So this is inferior epigastric vessel. So this fold is overlying the inferior epigastric vessel. This is occluded umbilical artery and this is urachus. This diagram is very important. In exam they can ask you in MCQs also that urachus is present now, or the what is the is it the urachus present now, or what is the remnant of the urachus? This is the median umbilical ligament. Then what is the remnant of the umbilical arteries? It is the medial umbilical ligament. What will be the fold which is showing the presence of the inferior epigastric vessels? It is lateral umbilical fold. So this is median umbilical fold. This is urinary bladder. This is apex of urinary bladder. This is umbilicus. This is a remnant of urachus. Then this is medial umbilical fold, and there are the medial umbilical ligament which are present below it, and it is the remnant of the obliterated umbilical arteries in the fetus. And this is lateral umbilical fold. They are showing the presence of the inferior epigastric vessels. This one is the round ligament of the liver. This is falciform ligament. This is supraumbilical part of the anterior lateral abdominal wall, and this is the infraumbilical part of the anterior lateral abdominal wall. There are three fossa which are present in between these folds. See here in this diagram, this is urinary bladder. This one is the supravesical fossa, that is above the urinary bladder. Vesical means urinary bladder. So this is supravesical fossa, which is in between the median and the medial umbilical folds on each side. Then this fossa, which is in between the medial and lateral umbilical fold, this fossa is named as inguinal triangle or medial inguinal fossa or Hazel-Batch triangle. Hazel-Batch triangle. Then the fossa which is lateral to the lateral umbilical fold, this is the lateral inguinal fossa. So these fossa, they are also very important. See here in this diagram, this is median umbilical fold, this is umbilicus, this is urinary bladder, This is apex of the urinary bladder. Then this is medial umbilical folds, and these are the lateral umbilical folds. This fossa is named as supravesical fossa. This fossa is named as inguinal triangle or medial umbilical fossa, medial inguinal fossa, and Hazelbatch triangle. And this fossa is named as lateral inguinal fossa. See here again, this is supravesical fossa, this is medial inguinal fossa or Hazelbatch triangle or inguinal triangle. There are three names for this fossa. In exam, inguinal triangle can be written, Hazelbatch triangle, or the medial inguinal fossa. And this fossa, which is lateral to the lateral umbilical fold, this is lateral inguinal fossa. In this diagram also you can see this is umbilicus, this is median umbilical fold, then there will be medial umbilical folds and the lateral umbilical folds. This is inferior epigastric vessels which are present here. And this is the subinguinal space. See here, subinguinal space. In exam, it can be asked that what are the contents of the subinguinal space, or what are the structures which are passing through the subinguinal space. There is one muscle which is iliopsoas muscle. There is femoral nerve, femoral artery will be there which is coming out from the external iliac artery. There is external iliac vein and the femoral canal. So these are the structures which are traversing the subinguinal space. This is myopectineal orifice. Myopectineal orifice. This is supravesical fossa. This one is the supravesical fossa. This is the medial inguinal fossa or inguinal triangle or Hazelbatch triangle, and this is the lateral inguinal fossa. Through the Hazelbatch triangle, the direct inguinal hernia is very common, and through the lateral inguinal fossa, the indirect inguinal hernia is very common. So these are the supravesical fossa. Then there is the medial inguinal fossa, and this is lateral inguinal fossa. The supravesical fossa is between the median and medial umbilical folds. Then this is the medial inguinal fossa. It is between the medial and the lateral inguinal folds, umbilical fold. See here, the word umbilical will be used with the fold, and the fossa are inguinal because they are present in the inguinal region, but the fold because it is attached to the umbilicus. So medial umbilical fold but medial inguinal fossa. This is lateral umbilical fold and this is lateral inguinal fossa. So this is also called as the medial inguinal fossa. It is also named as the Hazelbatch triangle or the inguinal triangle, and direct inguinal hernia is very common through this site. The lateral inguinal fossa is lateral to the lateral umbilical fold, and here the indirect inguinal hernia is very common. This is urinary bladder. This is apex of the urinary bladder. This is median umbilical fold, and this is medial umbilical fold. This is lateral umbilical fold. This is supravesical fossa. This is medial inguinal fossa, and this is lateral inguinal fossa. This question has been asked in OSPI as well as SEQ in Prof. See here in this diagram, this is urachus, or this is the median umbilical fold. This is medial umbilical fold, and this is lateral umbilical fold. In the region of the lateral umbilical fold, there are inferior epigastric vessels. This is inferior epigastric vessel. Then this is supravesical fossa. This is the medial inguinal fossa, and this is the lateral inguinal fossa. In the medial inguinal fossa or the Hazelbatch triangle or the inguinal triangle, the direct inguinal hernia is very common. There is iliopubic tract which is present here, which is demarcating the site of the direct inguinal hernia above the iliopubic tract and the femoral hernia below the iliopubic tract. And this is the lateral inguinal fossa through which the indirect inguinal hernia is very common. Again, you can see here, this is the median umbilical ligament, This is the medial umbilical ligament and this is lateral umbilical ligament. This is supravesical fossa. This is inguinal triangle or the Hasselbach triangle or the medial inguinal fossa, and this one is the lateral inguinal fossa. Now the supraumbilical part of the internal surface of the anterior abdominal wall. In this diagram you can see that there is one ligament which is named as the falciform ligament or the round ligament of the liver. This is falciform ligament. See here in this diagram, this falciform ligament has a round ligament of a liver and this is the paraumbilical vein. So this is the supraumbilical part of the internal surface of the anterior lateral abdominal wall. It encloses the round ligament of the liver that is also named as the ligamentum teres of the liver and the paraumbilical vein in its inferior free margin. See here, this is falciform ligament. This falciform ligament is present on the anterior surface of the liver. It is attaching the anterior surface of the liver to the anterolateral or anterior abdominal wall. In the falciform ligament, in its inferior part, there are the paraumbilical veins and the round ligament of the liver. The round ligament is a fibrous remnant of the umbilical vein. This question will also come in your MCQ, that the round ligament of a liver is a remnant of the umbilical vein which passed from the umbilicus to the liver in the fetus. This is the umbilicus and this is the round ligament of the liver and the paraumbilical vein. This is the falciform ligament of the liver. So this was the lecture about the internal surface of the anterior lateral abdominal wall, and I have discussed the supravesical fossa, the inguinal triangle and the lateral inguinal fossa. Thank you very much.